Good day to everyone joining us, and welcome to today's X Talks webinar. Today's talk is entitled Advancing Understanding of Long COVID, Leveraging Patient Perspectives with the Symptom Burden Questionnaire. My name is Sonia Hunt, and it's my pleasure to be your X Talks moderator for today. Today's webinar will run for approximately 60 minutes. This presentation includes a Q&A session with our speakers. At this point in time, I'd like to thank Mapi Research Trust, who developed the content for this presentation. Mapi Research Trust is a nonprofit organization that facilitates access to clinical outcome assessments for the entire scientific community. With more than 30 years of experience in the field of COAs and with the online platform eProvide, which includes databases on COAs, claims, and guidance, Mapi Research Trust is a preeminent source of information on COAs. Now, it's my pleasure to introduce our speakers for today's webinar. And first, I'd like to introduce you to Professor Melanie Calvert. And there she is. She is Professor of Outcomes Methodology at the University of Birmingham, UK. She is a Director of Birmingham Health Partner Center for Regulatory Science and Innovation and Director of the Center for Patient-Reported Outcomes Research, which aims to optimize the use of patient-reported outcomes in clinical trials and routine care to improve service delivery, enhance patient care and outcomes, and ensure that the patient perspective is at the heart of health research and healthcare decision-making. She is a member of the National Research Ethics Advisory Panel and is a NIHR Senior Investigator. So there is Mel. Now it's my pleasure to introduce you to your second speaker, Dr. Sarah Hughes. She is a research fellow at the Center for Patient-Reported Outcomes Research at the University of Birmingham and an honorary research fellow at Swansea University, where she is also a James Collingham Scholar. Hi, Sarah. With a background as a qualified speech and language therapist and over 20 years of clinical experience in the UK's National Health Service, Dr. Hughes brings a wealth of expertise to her role. Dr. Hughes joined the University of Birmingham in 2020 and focuses her research on optimizing patient-reported outcomes for long-term conditions. So thank you very much, Sarah. Next is Tatiana Kennard. She's a manager of author collaboration unit at Mapi Research Trust. And Tatiana, there she is, hi Tatiana, has led the team of account managers and account executives within the author collaboration unit since 2023. In 2021, Tatiana joined the author collaboration unit at Mapi Research Trust to establish new collaborations with the developers and/or copyright holders of clinical outcome assessments and assist them with the daily management of their questionnaires. She has extensive client services experience and has also managed suppliers as a buyer. All right, now it's my pleasure to pass the mic over to Mel. So Mel, when you're ready, you may begin.
Thank you very much, Sonia, and thank you to all of you for joining today to hear more about the Symptom Burden Questionnaire that we've developed for the management of long COVID. So next slide, please. So here are our disclosure statements for myself and Sarah. I just wanted to note that the work was funded by the National Institute for Health and Care Research and also UK Research and Innovation. But the views that we expressed today in the presentation are our own personal views and not necessarily those of the NIHR, the Department of Health and Social Care or UKRI. I'd also like to take this opportunity just to thank the amazing team that worked with us on this project. It wasn't just myself and Sarah, we had a brilliant team to work with, and especially our patient partners who were integral to the work that we're going to present today. So next slide, please. So in today's session, we're going to discuss the importance of patient-reported outcomes for novel and emerging conditions, and particularly in the context of COVID. And then I'm going to hand over to Sarah to describe the development and the validation process that we went through for the Symptom Burden Questionnaire for long COVID. And we then want to highlight to you the potential applications of the SBQ, how you might potentially use this in your own research, in clinical trials, in clinical care, and also to share with you some of the ongoing work that we're doing with the SBQ, the latest developments around this and what we're trying to achieve going forward. And then just to wrap up the end of the session, we'll discuss the learnings from the pandemic and key considerations for PROs in the context of multi-system conditions and multimorbidity. And we can pick that up further in the discussions today if we have time. So please do put your comments in the chat as well, as Sonia said. So next slide, please. So Sonia has mentioned this briefly in the intro, but just a couple of slides in terms of where we're coming from in terms of the Centre for Patient Reported Outcomes research that led on the development of the questionnaire. So the centre is based at the University of Birmingham. We work across Birmingham Health Partners with a number of hospitals. So we're co-located with University Hospitals Birmingham NHS Foundation Trust, which is a tertiary referral centre, large tertiary referral centre. And we have around 80 members working in our centre, with around 14 core members of staff in our team. And the SBQ is just one of our many projects that we work on. But what we're trying to do is really optimise the use of PROs both in trials and in routine care, and as Sonia said, to really improve the care, the service delivery and the outcomes for patients, and really making sure that their voice is at the heart of healthcare decision making. And this is really important both in the context of long COVID, which we're going to focus on today, but also in other conditions as well. So next slide, please. And just before we move on to the main focus of the presentation, obviously at Birmingham we're undertaking a lot of research. We also do offer consultancy to a range of pharmaceutical company clients. And we've had the privilege of working on international guideline development with a range of international stakeholders, including the FDA, the MHRA, European Medicines Agency and Health Canada, clinical groups and academics, and crucially patients are central to all of our work. And some of that guidelines are around international protocol guidance for clinical trials, recently cited in the FDA patient-focused drug development guidance, reporting guidelines, ethical guidelines. So please do have a look at some of our broader work if you get a chance. Today, though, we are going to focus on the questionnaire development and the work within the therapies for long COVID study. So just to put this in context, sorry, next slide, please, Sonia. To put this in context, the Therapies for Long COVID study was funded by the National Institute for Health Research and UK Research and Innovation. It was one of several that were funded in the UK at that time, really trying to improve the care and support for individuals that were encountering long COVID. As we know, many people sadly had acute infection and several, large numbers sadly passed away. But for those that then survived COVID infection, many were then telling us that they were experiencing long-term lasting symptoms, really burdensome symptoms that were really impacting on their lives. And so the aims of the TLC study were to evaluate the symptom burden and underlying pathophysiology of long COVID syndromes in non-hospitalised individuals and the impact on quality of life and work capability. And we also wanted to identify potential therapies and co-produce a remotely delivered non-pharmacological intervention delivered by a decentralised platform trial to support individuals with long COVID. And the work that we did on the Symptom Burden Questionnaire was part of this broader study. So next slide, please. So now I want to turn to considering the importance of PROs for novel and emerging conditions. And as we can see on the next slide, when we encounter a new emerging condition, these conditions often are symptomatic. They can lead to significant burden for individuals. And for those who survive infection, reducing symptoms is often a major focus of intervention. So obviously during the pandemic, the initial work was really trying to save lives. This was crucial. But then as people did survive COVID, it became apparent that there was really a need to also try and reduce the symptoms and the long-term effects of COVID for those individuals. And patient-reported outcomes can play a really important role with novel and emerging conditions because they can be used to evaluate the disease trajectory, but also they can be used to assess the efficacy and tolerability of therapies. So this might stem right from vaccines, where we might want to understand the tolerability and the efficacy of vaccines from the patient perspective. So PROs can play an important role there. But also for those individuals that have had the disease and been infected, thinking about their long-term management, patients with long COVID experience a range of symptoms, as Sarah will tell you about in a moment. And really, a key thrust of any therapy and a key focus of any therapy is around trying to help patients manage those symptoms, reduce the symptom burden, reduce their symptoms, both in terms of frequency, severity, the types of symptoms that people are experiencing, is a major focus for disease management. So next slide, please. But developing PROs for new and emerging conditions can be quite challenging, because often in the past, I think, when we've been involved in PRO development, we had a reasonable understanding of what the condition was that we were encountering. But in new and emerging conditions, trying to define what the concepts of interests are can be exceptionally challenging. Very limited information about the disease and its trajectory. Also defining the target population that you're interested in as well. So initially we were focusing on non-hospitalised individuals within the TLC study, but we actually broadened our inclusion criteria within that work as well, for those individuals that had some time in hospital, not an overnight stay, but it's just trying to think about that target population. And then thinking about what is that disease trajectory over time, and also how to manage infection risk and control. So traditionally with development of PROs, we might have done face-to-face interviews or focus groups, and clearly that wasn't possible during the pandemic. So just thinking about novel ways of working and trying to elicit concepts from key stakeholders. So next slide, please. So now I'm going to hand over to Sarah to tell you more about how we went about the development and validation of the Symptom Burden Questionnaire for long COVID. So over to you, Sarah. Thank you.
Thanks very much, Mel. So as Mel said, the Therapies for Long COVID study was one of the major UK government-funded studies looking into understanding long COVID and developing interventions to support people living with long COVID. And a core part of that was patient-reported outcome data capture. So patient-reported outcomes as measures of how a person feels and functions was absolutely crucial. So as part of the study, we developed a new disease-specific patient-reported outcome measure, which we've called the Symptom Burden Questionnaire. But what was the rationale for developing this measure? As Mel's just said, some of the challenges that we were faced was the fact that long COVID was a new and emerging condition. So when the TLC study team were looking to select PRO measures to include in the study, we presented a shortlist to a number of our wonderful patient partners, members of our patient and public involvement group, and asked them to appraise these. And the feedback that we received was that they just simply weren't a reflection of their lived experience. So we, as a team, took the decision to rapidly develop and validate a new measure, which we've called the Symptom Burden Questionnaire. Next slide, please. So that study was a multi-phase prospective mixed method study. It ran from April the 1st, 2021 to August the 1st, 2021. And for those of you on the call who may be familiar with measure development and validation, will appreciate the rapid pace of work that needed to go on at this crucial time. Our participants were adults over the age of 18 with self-reported long COVID. We went with the decision to involve individuals with self-reported long COVID simply because back in 2020, the testing facilities certainly weren't in place and not everyone had received a positive confirmation that they had SARS-CoV-2 infection. But we felt it was still important to be inclusive and to include these individuals. So we had 13 adults to support our cognitive interviewing processes, where we were sense checking the draft versions of the questionnaire for relevance and comprehensiveness. We had 10 clinicians to provide subject matter expert input. And then a group of adults with 274 adults with self-reported long COVID completed the questionnaire and a field test. And we use these data to evaluate the psychometric measurement properties of the questionnaire. But core to when we started out and tried to conceptualize what a measure needed to look like, we developed the following specification. Firstly, It was absolutely crucial that we followed regulatory guidance when developing the measure, and I draw reference here to the FDA's Patient-Focused Drug Development Series and also international best practice consensus-based guidance such as the COSMIN initiative. And this was because we wanted this measure to be utilized not only in major observational studies, but also in clinical trials and for regulatory approvals. We knew it needed to be comprehensive. The Therapies for Long COVID study, the TLC study, was aimed at characterizing long COVID. So it was absolutely vital that we were capturing this myriad of symptoms, this heterogeneous large number of symptoms that were relapsing and remitting to really try and characterize this new condition. But we were also very mindful that some of these symptoms were quite debilitating. We're talking about things like fatigue and brain fog. And so it was really important that we also minimize participant burden when completing the questionnaire. This was a decentralized study, so we needed to enable the SBQ to be captured remotely on electronic platforms, and that we also needed a safety net. So although we weren't providing a clinical service within the TLC study, we were signposting participants via a nurse-led support service, and we needed a way to flag when participants were reporting symptoms of clinical concern. Next slide, please. So one of the unique points of this process of developing the SBQ was that we did it in partnership with medtech company Apparito Limited, who have the ADAM5 platform, which is a disease agnostic, language agnostic digital trial platform for PRO data capture. We worked with Apparito extremely closely, and we developed the SBQ as an electronic or an ePRO from inception. So typically, traditionally, PRO measures would be developed using paper versions and then migrated onto electronic platforms later on, depending on the specific context of use. We utilized Apparito's platform to actually develop the measure. So this allowed us to work rapidly and to take a really iterative and comprehensive approach where we were able to combine elements of cognitive debriefing with usability testing. So for example, not only were we checking for item relevance, were the items clearly worded, were they comprehensive, we were also asking participants how they liked the layout, the format in the app, whether they were able to use the toggle switches or the slider bars, things like that. Next slide, please. So this is an overview of the process that we went through during that period in summer 2021. We started with a symptom review that was led by my colleague, Dr. Lee Agabusi, here at the University of Birmingham. And we developed a long list of symptoms that had been reported in the published literature relating to long COVID. And we used that information to develop an initial item pool, which was over 90 items. And at that point, we were really quite concerned that this was going to be quite a large instrument and potentially quite burdensome. But interestingly, when we took this draft instrument into cognitive debriefing and asking patients about the relevance and comprehensiveness, what they were telling us was that we don't mind the length if the items resonate with my lived experience. And they were absolutely instrumental in ensuring we had a really comprehensive measure. So our item pool swelled by over 60 items following cognitive debriefing. And so we were able to manage this large number of items for the over 200 symptoms of long COVID by leveraging the functionality of the Apparito ADAM5 platform. We then, as I just mentioned, took that information through to field testing, and we used modern psychometric methods, rash analysis, to not only refine the response scales, but also to refine the items and to arrive at the final scale structure of the SBQ. For those of you who are interested in the psychometric properties and understanding that process in more detail, I'd signpost you to our BMJ article, which will be attached as a handout to this webinar. Next slide, please. So what exactly is the SBQ? The SBQ is a modular patient-reported outcome measure, which is a multidimensional item bank. And if you're unfamiliar with item banking, all an item bank is a repository, a database of validated items for a particular condition. So the way we've constructed the SBQ, and I'll just go back for a moment. So an item bank is attractive because it's inherently flexible. It, as a repository, as a database, it gives us a lot of flexibility in being able to create new tools from this existing bank of questions. These can be things like short forms or screening forms or global score, also using things like computer adaptive tests. But also, because it is a set of 17 standalone scales, this is the modular element, people who are interested in administering, groups who are interested in administering the SBQ can either select it in its entirety for a really comprehensive measure, or they can select individual scales. So of these 17 scales, 16 relate to symptoms, and they're grouped along body systems, so thinking like pain or sleep or muscles and joints, skin and hair, ear, nose and throat. And then there's a final scale which we've called interference, or in the actual form we've called it impact on daily life, which measures the interference on daily activities arising from symptom burden. Next slide, please. So that's an overview of the process that we went through to develop and validate the SBQ. What I'd like to share with you now is a little bit more around the practicalities, what the SBQ looks like, its administration and its scoring. Next slide, please. So the SBQ is available via the University of Birmingham, and there's a dedicated website, and we'll provide you with that information. And everything's available for for digital download. So this is the paper version available as PDF downloads. It comes with the bundle comes with a user manual and then the paper-based form. Next slide, please. In terms of administrating and scoring, the format of the SBQ, as I just mentioned, there's the paper format. There's also capability for it to be delivered as an electronic PRO. So that can be either through the established Apparito system, but we've made it system agnostic, and Tatiana will speak about that a little bit later on in this webinar. The SBQ was developed in UK English, that's the source instrument, and that we now have available a number of translations in Japanese, Chinese, Arabic, and US English. In terms of administration, the SBQ is designed to be self-completed, and that's sort of the essence of what a PRO is. However, we also recognize that for various reasons, whether that be due to poor health or severity of symptoms or difficulty with accessibility, it may be not possible for individuals to self-complete. And in these circumstances, we're very supportive of the SBQ being delivered via an interview. The completion time is very dependent on how the SBQ is administered, whether it's being done as a comprehensive overview, so you're going to give all 17 scales, or a more targeted approach where specific scales may be selected. It also depends on the format. So in the Apparito electronic version, we're able to administer the full SBQ, all 17 scales, in under 10 minutes. And we would expect it to be approximately 15 to 20 minutes for a paper version to be completed. In terms of scoring, each item is scored on an ordinal response scale, either a 4-point scale measuring severity, frequency, or interference, or as a yes/no question. The scores for each item on a scale are summed to produce a raw score for that scale. Then in the manual, there's tables at the back which allow you to convert the raw score for each scale into a 0 to 100 score. And the benefits of doing that is that it allows you to almost profile across these different systems, across the different scales, to look at where symptoms are either most burdensome or least burdensome. In terms of interpretation, higher scores on the SBQ are indicative of greater symptom burden. Currently, we do not yet have normative data for the SBQ, and we have not yet got information relating to meaningful change in the SBQ scores. However, this is planned work that we will be undertaking in the coming months. Next slide, please. As I mentioned, the SBQ has a modular design, and this slide just shows the different domains of and areas of the body which it assesses. And because it's organized according to system or domain, we feel this has potential applications across a myriad of other conditions which are multi-system conditions. And also in patients who may be experiencing multimorbidity, that is 2 or more chronic conditions where there may be an overlap of symptoms, where it's not so important to maybe look at the underlying mechanisms, but also to look at how these symptoms present in the individual across systems. Next slide, please. In terms of how the SBQ can be used, in the TLC, it was used for remote capture of symptom data, and we feel this also has application for real-world evidence generation. For researchers in a clinical trials context, the SBQ can be used to evaluate the safety, effectiveness, and tolerability of treatments. It's also suitable for use in routine care as a flexible measure of long COVID symptom burden. It can be useful for monitoring in real time. The 7-day recall period means it can be administered weekly, and there's also potential for ad hoc administration should an individual be experiencing a relapse or a flare in symptoms. And also there's capacity for developing electronic alerts. The clinical alerts are not part of the SBQ per se. We considered that those alerts to be very specific to the context of use. So there's flexibility within the license and for users to select their clinical alerts. What we do offer within the user manual is guidance around best practice for ePro alerts or PRO alerts and exemplars to support users. Next slide, please. So if you're interested in the SBQ, and you'd like to view it for yourselves, you can go on to the SBQ website at the University of Birmingham, and that will direct you to our licensing website, the Micro Gateway website, which is the screenshot we show here. In terms of what needs to happen to select a license, you would visit the website and then select according to user category. The SBQ is free to use for all non-commercial activity, whether that be in routine care or for research use. And we have a commercial license for for-profit organizations. So you would just need to submit a license request, and once approved, the SBQ would be available for download. Tatiana will talk more about the translation and ECOA side of the SBQ, which we're partnering with Mapi and have been working really well to deliver those. So if we go to the next slide, please. So this is an exciting development. Of course, the SBQ for long COVID is developed for adults over the age of 18, but it's not appropriate. We can't just assume that children and young people are miniature adults. So we've been recently awarded funding from the UK government, the National Institute of Health and Care Research, to adapt the Symptom Burden Questionnaire for young people. Next slide, please. So this is work that we're just getting started with. We estimate that the release date of the SBQ-Y, the SBQ for young people, will be this time next year in October 2024. The age range will be between 11 and 17 years, and we aim to provide a self-report version, but also recognizing that there may be occasions where children are unable to self-complete and an interview format may not be appropriate. And so for this reason, we're developing a proxy report where parents and carers will report on their child's symptoms as they believe their child would. So watch this space, and we'll be hopefully providing you with an update in October 2024. Thank you. Next slide, please. So that's a little bit about the SBQ. So just to wrap up, I thought it would be useful to kind of share some of the learnings and reflections from our team, having gone through the process of PRO development in real time with a novel and emerging condition. Next slide, please. So as Mel's already alluded to, long COVID has really challenged our thinking about PROs and how we develop our PROs, specifically as for the condition, we were developing the patient-reported outcome measure in real time along with our emergent understanding of the condition. Typically, you would have a well-defined, well-described condition in a well-defined population, and we would use that information to develop the content for the items in the PRO. Next slide, please. But in this case, it was really a case of lived experience driving discovery. Long COVID is a term that has been developed by patients for patients to describe the symptoms and to get acknowledgement from the medical community of their experiences. And to mirror this, the SBQ is really mirrors this lived experience driving discovery, in the sense that it was our patient partners that pushed us to develop a measure, and they were instrumental at every stage of the development and validation process in terms of ensuring we ended up with a measure that was really reflective of their lived experience and validated what they were experiencing. Next slide, please. And it really, the pandemic has really made us think about the need for a flexible approach to PRO data capture. We need PRO measures, and particularly thinking forward in terms of pandemic preparedness, that we have measures that are comprehensive and that can be tailored at short notice and at pace to capture the full range of symptoms as experienced by individuals in new and evolving conditions. But equally, in the context of long COVID, as we start to improve our understanding of long COVID, our understanding of the mechanisms that are driving this condition, our PRO measures must also facilitate targeted interrogation of symptoms and symptom clusters so that we can develop safe and effective treatments. But equally, we also need to understand that with the change in definition and understanding of long COVID, that the PRO measures must also change with this understanding. We must ensure that the content and the concepts that the PRO is tapping into remain a current part of our definition of long COVID if these measures are to remain reliable and valid. Next slide, please. And controlling the symptoms of long COVID is a key target for the long COVID community. Being able to control symptoms and measure their impact on quality of life, activities of daily living and work capability is absolutely critical. And the PRO measures, such as the Symptom Burden Questionnaire, are key and well placed to do this. And this slide simply shows an example of ongoing trials for new therapies for long COVID that are utilizing the SBQ. Next slide, please. The other thing that the pandemic has shown us is that PRO measures need to be measures that are for global health. There's an estimated 144 million people currently living with long COVID worldwide, which is putting immense pressure on health systems around the world. So any measures that are developed for management and assessment of long COVID must be inclusive of the diversity of lived experience. If we're using PRO measures that are not representative, there's risk of introducing bias with implications for decision making as we go along to evaluate the effectiveness and tolerability and safety of new interventions. So we need to have PRO measures that are suitable not only in high-income developed countries, but also for our low and middle income countries as well. Next slide, please. So how is the SBQ looking to address these challenges? As I said before, by taking an item banking approach and a modular approach to PRO measurement, we're aiming to develop a flexible, future-proof PRO measure that can be evolved and refined as our understanding of long COVID refines. We're seeking to remove barriers to accessing translations, and Tatiana will talk to you more about that shortly. We're offering a variety of licenses, and non-commercial licenses are free for use. And we're taking a really collaborative approach to the development and implementation. And a good example of this is our work with the SBQ for young people. We're partnering with the CLOCK study out of the University College London, which is the largest study of long COVID in children globally. So I'm now going to hand over to Tatiana to talk to you a little bit more about translation and ECO.
Thank you very much, Sarah. So now about the conditions of use and about the existing language versions for SBQ LC. So first of all, the first step is always to sign a license agreement with the University of Birmingham, as the university is the copyright holder of the SBQ LC. So before to access the original translations or electronic versions, please first submit a request with the university. A user fee may apply depending on user category, so please refer to the website. And only after that, you need to contact Mapi Research Trust if you have a request for translation or electronic implementation of the SBQ. All the requests for translation and immigration must be submitted through our electronic platform, eProvide. So Mapi Research Trust, we're a non-for-profit organization dedicated to improving patients' quality of life by facilitating access to patient-centered outcome information. And our ProQuality database, in which over 5,900 questionnaires are described, centralizes all the information on the SBQ LC, such as conditions of use, development, validity, reliability, and available translations. I'd like to emphasize the added value of ProQuality to centralize all the information about the questionnaires so that it is reliable and easily accessible in the future. Next slide, please. So the next slide will show you how to submit a request through eProvide platform. That is really a quick and easy process. You will need to provide some basic information to create your client account, submit your request, and you will receive a notification by email that your request was successfully submitted. Our Mapi Research Trust team will reach out to you within 2 days on the next steps to follow. And now about the translations. So several translations of the SBQ LC are available and more currently being developed. Availability will be confirmed at the time of receipt of each request. So on the next slide, you see the process to follow. For commercial users, all the new translations are produced exclusively by Mapi Research Trust linguistic validation partner Icon Language Services in collaboration with SBQ LC developers Professor Calvert and Dr. Hughes. The academic users are authorized to translate SBQ LC on their own, but first they need to submit requests with the Mapi Research Trust and sign a translation agreement. Our team will provide you with the linguistic validation guidelines, and the final translation that will be produced by the academic researchers needs to be provided to Mapi Research Trust so that it can be further distributed to other academic researchers free of charge and to be used in local academic studies exclusively. I'd like to emphasize that all the translations of the SBQ LC are owned by the University of Birmingham. Next slide, please. So regarding the condition to implement into electronic applications, please note that the authors of SBQ LC have developed an electronic model with a Pareto Atom 5 clinical trial platform. So if you are interested in learning more about these electronic versions in Atoms, please submit your request with the University of Birmingham. However, all the sponsors are free to select their own e-vendor, system, or device of their choice for the electronic migration of the SBQ LC. Please note that if a new translation needs to be included into an electronic device, system, or platform, including Operative Item 5 clinical trial platform, Icon Language Services will be the unique vendor for the mandatory electronic migration review, and approval of screenshots of the SBQ LC translations. Next slide, please. Please also note that for any new request for electronic migration, Mapi Research Trust team will provide you with the e-booklet. This e-booklet was developed in collaboration with Professor Calvert and Dr. Sarah Hughes, and it is an electronic implementation guidance which accompanies the user through the development of an electronic version that already has been validated by the developers. And it also provides the detailed technical and validation specification. The work performed can be certified only once it has been confirmed as being in line with the instructions of the e-booklet. So also please note that all the electronic versions of the SBQ LC are owned by the University of Birmingham. Thank you. And now up to Mel.
Thanks, Tatiana. So just in summary, what we've aimed to demonstrate today is that the SBQ is a comprehensive multi-dimensional item bank which addresses symptom burden. The license is available from the University of Birmingham, and translation and eco and migration is managed by Mapi Research Trust. Through this work, we aim to provide comprehensive coverage across body systems, and this offers a flexible measure for use across multiple chronic conditions and also for rapid deployment in future pandemics and emerging conditions. So we hope that the work of the SBQ will continue, and indeed we're already doing work in this area to advance it for use in other chronic long-term conditions. So now I'm going to hand back to Sonia for the Q&A session. Thank you.
Well, I'd like to say thank you first to all of our speakers for that very engaging and detailed presentation. I hope everybody enjoyed it. And now it's time for the Q&A portion of the webinar to begin. And I just want to remind our audience members that you still can continue to send in your questions by using that questions window that's located on the right-hand side of your screen. And we'll try to address your questions during the time we have together. And if we don't, rest assured that the team at Mapi Research Trust will follow up with you. Okay, so let's start with this first question here. This audience member, this is going directly to Sarah. This audience member is asking Sarah, is it okay to use certain questions or scales of the SBQ?
Oh, thanks very much, Sonia. As we discussed in terms of the modular system, that the approach that we've taken with the SBQ, it's absolutely fine to select individual scales. However, because of the way it's been validated, we do not recommend that you select individual items at this time for your own specific use. Not only does that limit the cross collaboration and comparison of data sets, but equally it's something that we could look at down the line in terms of conducting future tool construction, but that would not be recommended on a per study basis.
Okay, thank you very much for that. We'll go to our next question. This audience member is asking, would you recommend that pros for long COVID account for vaccinated individuals versus unvaccinated? That's an interesting question. Who would like to take that one?
I'm happy to take that one. I think depending on your research question, you could capture this information separately. So the SBQ is appropriate for use in both vaccinated and unvaccinated individuals. We've been using it within the Therapies for Long COVID study where we have individuals with a range of vaccination status and have successfully used it in that cohort. But if vaccination is of interest to you as part of your study and your rationale for your study, then of course capturing information on that alongside the SBQ would be highly appropriate.
Okay, thank you very much for that. Anyone else like to add? No? Okay, I'll go on to the next question here. Thank you for answering that. The next question is, do you include gastrointestinal symptoms? Who would like to take that one?
I'll take that one.
Thank you, Sarah.
Yes, there is a scale which that focuses exclusively on gastrointestinal symptoms.
Okay, perfect. Thank you. I'll go to the next question here. A lot of them are coming in quickly, so sorry for looking away from the camera as I'm trying to get everything here. All right, here's the next question. Is there a does it time out on a person, or can they take breaks while completing? I see this as critical for patients with fatigue. I'd like to address that one.
Sure, I can take that.
Thank you,
Yes,
Sarah.
we're very mindful that a number of many patients will be experiencing fatigue or brain fog or similar symptoms. So we encourage anyone who's completing the SBQ to take breaks, and whether or not it times out is dependent upon the EPRO system that you're using, but we would strongly encouraging, and the guidance is included in the e-booklet about allowing patients to go back and to revisit and to take breaks if needed.
Okay, thank you, Sarah. All right, this one here, this individual's asking, dear speakers, may I inquire if you have preliminary data on how the SBQ score changes with time to reflect the natural history of long COVID? Who would like to start with that one?
I can take that one.
Sarah again, okay.
That's an excellent question. As part of the Therapies for Long COVID study, we've collected SBQ data at multiple time points, but we're just at the stage where we're going to be starting those analyses. So hopefully in a few months' time, we'll have some more concrete answers for you. I don't know if anyone else has anything else you'd like to add. So watch this space.
Okay.
Yeah, I think it's watch this space on that one. Thanks.
Okay, I'll go to the next question here. Oh, this one here looks like it may be for Tatiana. Can the SBQ be scored electronically?
Yes, thank you, Sonia. So yes, for sure, as explained during the presentation, the SBQ LC can be scored electronically. So if you want to migrate the SBQ LC into another device, platform, or another system than Atom Farm already existing with Aperito, you need just to submit a request with Mapi Research Trust. We have our own ECOA team that will provide you with the e-booklet and will also accompany you through this electronic migration to another device and to another system. They will also make the screenshots review, and they will also certify this electronic version.
Okay, perfect. Thank you so much, Tatiana. We'll jump to the next question. Thank you very much for this very interesting session. Thank you for that comment. How much time on average does SBQ take to fill out? That's a good question.
Okay, I can take that one. So with the EPRO system, as it's configured per the e-booklet, which is accessible through Mapi, we estimate between 8 to 10 minutes for the full 17 scales. If you're only administering 1 or 2 scales, it could be under 5 minutes or a couple of minutes. The paper version is slightly longer just because of the format it takes, and we estimate that at around 20 minutes.
Okay, thank you. All right, I'll jump to the next question here. Let's see. Okay, does the questionnaire consider any autoimmune diseases that might have been triggered by COVID? Very good question. Who would like to attack that one?
Sorry, are you happy to take that one now?
Yeah, I mean, I think, yeah, as we're learning more about long COVID and potentially things like the autoimmune diseases and things that go alongside that, I think that would have been picked up through our concept elicitation work with individuals that have long COVID. So when we were developing the questionnaire, we were really trying to understand the sort of symptoms that they were experiencing and the burdens they were experiencing. And so I think that it is a comprehensive measure and will likely capture the symptoms that those individuals are experiencing. So I think, again, if you're interested in particular subgroups of COVID, the long COVID population, we're finding that there's clusterings of particular symptoms, and some of our other work that we've published in Nature Medicine from the Long Therapies and Long COVID project sort of shows that and shows what those clusters look like. But we believe that the measure is appropriate for use in any of those clusters. It might be that as you start to move towards more targeted projects with focusing on particular interventions, targeting particular aspects of long COVID, that you might then want to select the particular domains that, as Sarah's described earlier, but we believe it's appropriate for those groups as well. Thanks.
Okay. All right, thank you. All right, I'll jump to the next question here. Is it okay to rewrite the questions or other text that doesn't work for my study?
I'll take that one. Thank you, Sonia.
Thanks,
that's a great question. Because of the way it's been validated, we ask that you don't change the wording of the items. They've been rigorously checked with our patient partners for their wording, for their relevance and their comprehensibility, and that the measurement characteristics of the SBQ are dependent on those items remaining unchanged. So to do so, and we actually specify that in the license. So no, please don't change the items. Thank you.
Thank you. I'll jump to the next question here. This audience member is asking, how often can the SBQ be administered?
So I think the SBQ has a recall period of 7 days. So it can be administered weekly. Also, within the TLC study, we use the SBQ to collect ad hoc reports of symptoms. It was really important to our patient partners that they have a means of reporting when their symptoms were flaring, because of the relapsing and remitting nature of long COVID. So weekly, because of the last 7 days, and again, because that's part of the validation, we ask that you don't change the recall period, but we also have permitted ad hoc reports.
Okay, thank you again.
If I can maybe just add to that,
yeah,
I think it really links with the rationale for your study in terms of the frequency of assessment and how frequently you want to do that. But I'd really encourage teams to work really closely with people with lived experience of long COVID in planning that. So, we touched upon earlier that, the brain fog, the potential burden, but also, depending on what your intervention's targeting and how quickly you expect that to work and how long you expect the duration the intervention to work for, might again influence sort of how frequently you want to collect those data. So I think it's really thinking about the rationale for assessment, the intervention that you're assessing, and then working with patient partners to work out what might be best for that particular group.
Okay, thank you, Mel. This looks like it's for you, Tatiana. This audience member is asking, is there a list of available ePro versions of the SBQ?
Yes, there is already the one version that has been developed by Sarah and Professor Calvert all together with the Atom5 Aperita platform. And that currently there are several that are being developed. So please submit your request with Mapi Research Trust, and we will inform you if there are any additional electronic versions. But usually everything is updated on our webpage. So please follow the SBQ LC webpage on ProCollit.
Okay, I think we have time for 2 more questions. This audience member is asking, is it okay to change the time frame?
I think we may have covered that off already in terms of the recall period and working with patient partners to establish the context of use.
Okay, I hope you got that there. Thank you. Next one, this is the last question. Who is the SBQ suitable for?
So I'm happy to take this, and Mel, please feel free to add your thoughts. So the SBQ is a disease-specific measure in the sense that it has been validated in a population of adults with long COVID, but because of its construction and the fact that it works across multiple domains and body systems, we feel there's great potential for it to be used in other conditions, particularly in the context of multimorbidity. So this is work that we are exploring to see how it may be applicable in other conditions.
Okay. Melanie, anything to add?
No, I think Sarah's covered it nicely there. Thank you.
Okay, all right. And
Thanks.
Tatiana? Okay, perfect. All right then. Well, thank you very much for those answers. We have reached the end of the Q&A portion of the webinar. If we couldn't attend to your questions, the team at Mapi Research Trust may follow up with you after this presentation. And if you have any further questions, please utilize the email addresses that you see there on your screen. Thank you everyone for participating in today's webinar. You will be receiving a follow-up email from Xtalks with access to the recorded archive for this event. Additionally, there is a link to view the recording of this event, which you can also share with your colleagues so they may register for the recording here as well. A survey window will be popping up on your screen. Your participation is encouraged as it will help us to improve on our further webinars and get even more out of today's presentation by downloading the supporting materials that we have available for you under the Handouts tab. And we have two there for you. One is helping you build your clinical outcome assessment strategies, and the other one is development and validation of the Symptom Burden Questionnaire for long COVID. So please go ahead and check that out. Now, please join us in thanking our speakers, Melanie, Sarah, and Tatiana, for that very insightful presentation and for answering all your questions. We hope you found this webinar informative. It has been my pleasure to be your webinar moderator. On behalf of the team here at X Talks, we thank you for joining us. Until next time, please take care.